Hello everyone. This year the theme of World Health Day is Depression, Let's Talk, and that is what we are here to do. Globally, depression is already the biggest cause of all health and disability. In the age group of 15 to 30 years, the suicide rate for every 1 lakh people is as high as 36. 1 out of 4 children in the age group of 13 to 15 suffer from depression. Cases of depression have surged by nearly 20% in the last decade. Every 10,000 suicidal deaths, every year 10,000 suicidal deaths occur only due to depression. And so this initiative taken by WHO seems worth. Let's find out from the people of RRMCH what they understand by depression and how serious an issue they...
Depression, I feel a person is in a confused state because of so many problems. He is not able to judge what is correct, what is wrong. And he will be searching for the answers, what he has to do and all. This I feel that is the depression.
According to me, depression is an impression of self which makes your brain and thinking to compression and your performance becomes suppression.
See, my dear friend, depression is a deviation from normal mood and normal activity, and people feeling sad, out of the way, anxiousness and sadness. That, I think, according to me, is depression.
Yeah, actually depression is so much part and parcel of life. It could be occurring at any age, at any socioeconomic strata, whether rich or poor people, highly educated or not so educated, literate or illiterate. At any stage of life, at any point of our life cycle, or for any man across the world, it could occur. Because human or man is a bundle of emotions, isn't it? So it could occur at any point of time. It all depends on our upbringing, outlook in life, and so on and so forth.
Okay, depression is a chronic mood state in which a person actually feels sad and low for a longer time. And once it qualifies or fulfills certain requirements, it becomes a diagnosable psychiatric disorder.
Actually, I have done a little bit of research about depression. I've learned that it's a state of mind. It's a clinical state of mind. It's not something that can be controlled. You feel externally, you can show that you're happy and all of that, but internally you're very affected. Everything and anything about you, around you, depresses you. It makes you feel sad and you feel very negative about almost anything and everything around you. And it can be a fraction of a second. You can be very happy and suddenly something strikes and then you start feeling a certain way. That's what I think, depression.
I feel depression is a place in a time in your life where you feel that you can't be happy and you're just sad in your life and you're just suffocated and you feel negative about everything. Yeah, just like this.
Depression is not a disease. I'm serious. Depression is not a disease. It is a disaster. Almost every person suffers from this disease at least once in their lifetime. A psychological condition that makes you feel hopeless, empty, and sad, and that's terrible.
It's just a mental illness with extreme sadness felt by normal people. And many people could have depression without even knowing it. So it needs to be, more people need to be aware of this condition. So that's what I feel.
According to me, depression is like a mood-related disorder. And normally people think that it's extreme sadness, but I feel it's way more than that.
So what do you think causes depression nowadays?
Usual stress, anxiety, lack of awareness, lack of spiritual growth. These can be a few factors. There may be childhood trauma, family events, bullying, postpartum depression in women, resulting in lack of self-esteem. But I think many a times depression doesn't have an identifiable cause.
Depression is a continuous state of mind where a person stays moody for a very long time, and it goes on. It might be minor to major. Minor is for time being you are, I mean for a very short period of time, but long term could be could be for weeks to years. As it goes on for a very long time, then it becomes more serious. As much as like a person might decide to go and think about suicide or attempt for suicide.
ಮನಸ್ಸಿನಲ್ಲಿ ಯಾರಿಗೂ ಹೇಳ್ಕೊಳ್ದೆ ಇಲ್ಲದೇ ಇರೋವಂಥ ಪರಿಸ್ಥಿತಿ ಇರುತ್ತೆ. ಅವಾಗ ಎಲ್ಲರೂ ಇರ್ತಾರೆ, ಅವ್ರಿಗೆ ಯಾರಿಗೂ ಎಲ್ಲರೂ ಶೇರ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಆದರೆ ನಮಗೆ ಯಾರಾದರೂ ಆತ್ಮೀಯವಾಗಿ ಕ್ಲೋಸ್ ಆಗಿ ಯಾಕಪ್ಪ ಹಿಂಗಿದೆಯಾ ಏನು ಅಂತ ಕೇಳಿದಾಗ ಅವರಿಂದ ಆ ವಿಷಯನ ಹೊರಗೆ ತೆಗೆದು ಅವ್ರನ್ನ ಡಿಪ್ರೆಷನಿಂದ ಹೊರಗೆ ತರೋ ಚಾನ್ಸಸ್ ತುಂಬ ಇದೆ. ಆದರೆ ನಾವು ಯಾವ ರೀತಿ ಅವ್ರ ಹತ್ರ ಮಾತಾಡ್ತೀವಿ ಅನ್ನೋದ್ರ ಮೇಲೆ ಹೋಗುತ್ತೆ. ಎಲ್ಲರ ಹತ್ರನೂ ಎಲ್ಲರೂ ಶೇರ್ ಮಾಡೋಕ್ಕಾಗೋದಿಲ್ಲ.
Now, the causes of depression can be many: exam failure, unemployment, relationship problems, debt, financial and social issues, and many, many more problems. So let's try to find out what their problems were.
Cause for depression, it may be due to loss in the business, or if some people, the parents, children, they lose the parents, or parents, they lose the children. Or you will have the alcoholic withdrawal syndromes, or you may have been a drug addict. Due to drug addiction, that withdrawal syndrome also may be there when he is not getting the drugs. These are the mostly causes.
Cause for depression is one internal and external. Internal, it can be health. External, it can be wealth. Health, see, if a person is not feeling well, he has some problem inside, but he cannot express it. So it again affects his performance. He might not be able to tell to others. External, again, when most of us, we start comparing ourselves with others and have some complex. See, this complex can be superior or inferior. When it is inferior complex, again it causes depression, because we think that, okay, why I am not able to be like some other person. When it is a superiority complex, sometimes we feel that, okay, somebody else is coming up. So whether I have to match him or I have to still go ahead, even those things can cause some amount of depression.
There are so many causes, according to me. Stress, for example, students, they may feel depressed because of stress, because of tension, not preparing well, not studying regularly, and ultimately when the exams are, because we deal with students, we are more on the college side and we deal with first year students, we normally see so many students at the time of examination coming and asking us, sir, what are the important questions? And how can we say, we will definitely say, how can we say everything is important? Then they will say, sir, especially as an anatomist, anatomy is so huge, sir, we are depressed, sir, we are tensed, sir, we don't know how to study. So for students, I think it is the stress and tension and depression leading to depression. Stress and tension is more because of fear of examination.
Well, as a medical faculty, we know that depression is caused due to maybe organic conditions or biological conditions or the perception in life and so on and so forth.
Okay, causes for depressions are varied. We usually follow the biopsychosocial model, in which we have biological disorders or deficiencies like serotonin and norepinephrine deficiencies, as well as psychological, when the person uses not so productive or positive coping skills and employs a lot of more negative and unproductive coping skills, as well as social causes, and when they do not have any family support and social support is very less, then they'll end up in a stressful situation which leads to depression.
In today's time, we've been hearing a lot about depression. I'm sure it always existed, but we've been hearing a lot about it lately. I think one thing is the world is so, overtaken by technology. People don't really interact much, and that I think plays a huge role. And it's a very competitive world. If you don't do very well in your exams, or if you're not very good at anything, you tend to get very heartbroken. Or even there's a lot of relationships and love failure, and all of that is also responsible for it. to an extent.
I feel there are many reasons for depression. Sometimes when you your hopes are shattered down. Sometimes you try your best and yet fail miserably. Sometimes you like something so much and you lose it. And these all things can cause depression.
Anything, right? I mean, could be some severe social issue or some tragic events that could have happened, monetary, I guess, or might just happen for some people.
Usual stress, anxiety, lack of awareness, lack of spiritual growth. These can be a few factors. There may be childhood trauma, family events, bullying, postpartum depression in women, resulting in lack of self-esteem. But I think many a times depression doesn't have an identifiable cause.
Causes for today's, I'm more of like it. The world has changed. It's a competitive world, and people are more worried about numbers. So they pressurize themselves a lot. They stress themselves a lot for that. And there could be some major incidents that has happened in a person's life, like loss of a loved ones and getting separated from loved ones, or it could be anything as such. Like it depends on how sensitive a person is. There are situations where a person has scored low marks and still gone for depression, and there might be no reasons in particular as well. Overall contribution of many factors might also lead to depression.
Wait. Have these people really been in depression at any point in their lifetime? Let's find out.
Once or twice it has happened to me. That is when I got the new job, first appointment. I was doing a private practice in 1975. I have to close that practice and come. And I was thinking, many people were telling, don't go and join there, do private practice only here. And my family members, they were telling, you join government job and all. I was in confused state. Some 1 or 2 days I had in depression type I had.
A good question. I think when I was a student, same thing, no? When I failed, in anatomy only I failed. Though I have now passed anatomy and a professor in anatomy, in first attempt I failed because of so many other reasons, laziness and not studying, and then I got depressed. And very sorry to say, at that time only I lost my father also. So all these these are some of the triggering factors, which they occur suddenly, then we definitely feel. And that time I was really depressed for about 3 months. But slowly, without any medication, I only conquered it and came out of it.
Oh, definitely, because I am a human being. I have gone through high and low. Whether it is the personal arena or the career arena, I have gone through high and low. I have felt about it.
Fortunately, not till now.
I sometimes used to feel that I'm depressed. I don't know if I was or not. Even now I feel it sometimes. But then, obviously that's why I researched about it. Otherwise I wouldn't have. So yeah, I don't know. But yeah, I think it's something that every student at least goes through at this point of time.
Not depression, but like 1 year back I was just sad in life. Like little, not too much like too depression type, like little sad.
Quite a few times have been in depression, but with love and care of dear ones, every single time I made it out.
What can be done to treat depression? Because that is the real issue of the World Health Day this year.
Help people come out of depression. What they can do is they can identify positive coping strategies and employ them more often. Once they start feeling low, sad or depressed for some duration of time, they can seek help, which could well be professional help, and then later on they can modify it and follow these things. If they meet a psychiatrist or a professional, then they would be treated with antidepressant if they require, and psychological intervention in terms of therapy, including CBT and psychoanalytical therapies.
I think more people need to talk about their problems to each other, or they need to be aware to, address their issues. So more people need to know that if they have depression or if they're feeling depressed, they should probably speak to a professional or a psychiatrist or a therapist.
Clinically, as we know, there are many drugs that are already being given, but I feel it's a lifelong disorder and it has to be tackled on the grassroots level. Starting with, first the person should come out and mingle with everyone and mingle with people, group activities, discussions, forums to help the person express their thoughts, their ideas. Counseling and therapy is an excellent option. I also do believe that you have to, meditation, jogging and exercise are a few things that someone can do.
Let's find out what we can do as an institution against depression, which is such a rising problem.
As an institution, we have to think that it is not an institution, it is our family. The whole institution is like a family. Only then we have to interact with each other, whether good or bad. You openly interact, open your mind, open your heart. Once you start talking openly, people will like you. Okay, there might be some hindrance, but still at the end of the day tell, okay, he is open-minded. Be open-minded, talk whether it is good or bad. You like someone, tell him that you like him. If you don't like, you tell him, but tell him why.
As an institution, we have had our own ways of handling stress in students. So we have a counseling cell which comprises of psychiatrists, psychologists and social workers, as well as mentoring program, which is basically designed to counter this kind of stress in the students. So at the earliest sign of onset of depression, we pay more attention to these people, and under our guidance we kind of help counselors as well as mentors to handle these issues for students.
Any final thoughts about this community medicine workshop that's coming up, sir?
Okay, this year WHO has chosen Depression Let's Talk as the theme for World Health Day, and depression being a very common problem, almost 20% of the world population getting affected by depression, and the burden what depression lays on the society is great. So to counter that, basically what we all have to do is, as soon as any sign of depression is seen in a patient, in a student or in a person whom is known to us, basically we have to seek help as far as possible. And a lot of self-help as well as centers have been established to counter this.
Thank you, sir. Thank you. Let's see what people have to say about the amazing initiative by WHO and of course the community medicine department of our college.
Actually, the community medicine people in our college are really doing a commendable job. I congratulate them.
I think it's an excellent initiative by the community medicine department. I think it was high time that all of us, I think one of the major causes is also lack of self-awareness. So this program helps to increase awareness amongst everyone. So I think it's a great initiative.
छुप छुप अश्रु बहाने वालों, मोती व्यर्थ लुटाने वालों, कुछ सपनों के मर जाने से जीवन नहीं मरा करता है। सपना क्या है नयन सेज पर सोया हुआ आँख का पानी, और टूटना है उसका जो जागे कच्ची नींद जवानी। गीली उम्र बनाने वालों, डूबे बिना नहाने वालों, कुछ पानी के बह जाने से सावन नहीं मरा करता है। लाखों बार गगरिया फूटी शिखर नाई पनघट पर, लाखों बार कश्तियाँ डूबी चहल पहल वैसी है तट पर। तम की उम्र बढ़ाने वालों, लव की आयु घटाने वालों, लाख करे पतझड़ कोशिश पर उपवन नहीं मरा करता है। लूट लिया माली ने उपवन, लेकिन लूटी न गंध फूल की, तूफानों ने छेड़ा पर खिड़की बंद न हुई धूल की। नफरत गले लगाने वालों, सब पर धूल उड़ाने वालों, कुछ मुखड़ों की नाराज़ी से दर्पण नहीं मरा करता है। And I feel this poem is enough to motivate us on this World Health Day, that no matter what happens in our life, it's never the end of our world, and we should keep moving forward. So we have come to a conclusion that depression can be treated by effective medication and psychotherapy. And there are numerous other ways in which we can treat depression, by the support of your family, building self-confidence, peer support and play, social support, building self-respect, financial stabilization, performance appraisal, love and care of our loved ones, and everything starts with a smile. So let's start this day with a smile. So it is time we wake up and face this challenge and focus more on mental health. Thank you very much. Have a nice day. Jai Hind.